When narcissists collide, the toxic power struggle. Hello, I'm H.G. Tudor. Narcissists frequently come together. Sometimes there is narcissistic cementation. You can watch the video in respect of that. More usually, there is a more tempestuous outcome when the narcissists collide. I've set out some of the various permutations in the two videos When Narcissists Collide Parts 1 and 2 to help you understand some of the outcomes between certain types of narcissists where they are involved in a romantic entanglement, familial one or social one. There are also instances where narcissists collide in the workplace. And, as you know, there are certain hunting grounds for narcissists which attract them because these arenas service the prime aims better than others. They provide more people who are controllable, not only in terms of the number of people available to interface with, but their propensity and susceptibility to being controlled. It provides arenas where there's a lot more fuel to be gathered, character traits to be acquired, and residual benefits galore. Politics is a clear area that attracts lots of narcissists because the wielding of political power allows the assertion of control, the drawing of massive amounts of fuel, access to character traits and residual benefits. The entertainment industry is another. And from time to time, I've introduced you to the various hunting grounds of the narcissist, and one of them is medicine. Here, I'm going to take you through an insightful analysis of an environment which, first of all, attracts narcissists because of the benefits that it provides. And if you'd like to understand more about why medicine is so attractive to narcissists, you can watch my videos about surgeon narcissists and doctor narcissists. And it also enables you to see what happens when there is a toxic power struggle, because the various narcissists that are involved in this particular instance of clashing in the world of medicine are fighting one another for control. And not only does this have an impact upon one another, but it has an impact upon the delivery of services and those that have to work with these individuals. Surgeons at a top NHS trust were embroiled in allegations of racism, sexism, homophobia, and bullying that created a toxic culture and harmed patient care, according to a secret report. Well, it's no surprise to learn that certain narcissists would be racist, sexist, homophobic, and bullying. This is because there's no emotional empathy, that they behave with a sense of entitlement, that they conduct themselves in this fashion because to bully someone allows the assertion of control over them. To be dismissive about someone with regard to their race, gender, or sexual preference not only shows that absence of emotional empathy, but is demonstrative of the fact that the narcissist simply doesn't care and they've no accountability for conducting themselves in such a fashion. Consultants responsible for treating thousands of facial trauma patients at Barts Health NHS Trust in London have accused each other of poor surgery, in effect, an accusation which might be based upon the truth or a lie, but is done to assert control over that person, causing avoidable complications and negligence. They say 3 patients went blind and others needed repair surgery. As a consequence, therefore, of this power struggle, patients have been harmed. The surgeons' relationships have deteriorated since 2017 amid a constant fight for power and control of the unit. Now, it might be the case that you would have one narcissist inserted into the unit and the others are just having to deal with that person's overbearing behaviour. But as you'll hear, it's quite clear that more than one narcissist is operating here, and because when narcissist A seeks to assert control over narcissist B, that is a threat to narcissist B's need for control, so they retaliate, seeking to nullify the threat from A and assert control over them. Their retaliation naturally provokes narcissist A and is viewed through the distortion field of the narcissism as a threat to control, resulting in A going back at B, and then involving C, possibly utilizing the indirect control over B by complaining to C. And thus you get, for want of a better description, a clusterfuck of narcissists at one another's throats as they seek to assert control in a bullying and domineering fashion, which provokes the other narcissist who has to retaliate, and their retaliation is a threat to control, and it's like a game of tennis. Back and forth they go. At least 7 patients who had been waiting for operations for between 3 and 5 years had their procedures cancelled after 2 doctors refused to work together, assertion of control by withdrawal. The Trust admitted that no action had been taken against any of the surgeons, and it only informed the Care Quality Commission about the report and its findings after the Sunday Times made inquiries. The Trust said it had found no evidence of patient harm and believed the service was safe. The Trust Oral and Maxillofacial Service is one of England's top specialist centres, handling injuries and diseases including cancer that affect the face, neck, mouth and jaw. It treats 10,000 people a year, 2,000 of whom have serious injuries. An external investigation was commissioned by the Trust in June after years of disputes between the surgeons, showing a pattern of behaviour over a sustained period of time, working in the Royal London Hospital in Whitechapel and Whipps Cross University Hospital in Walthamstow, which fall under the Barts Trust. The report, which was leaked to the Sunday Times, cost £45,000 and was carried out by Sarah Dobson, a lawyer at Ibex Gale, a workplace investigation company. It was given to the Trust in November, but one insider said nothing appears to have happened since, adding, "The department doesn't pass the friends and family test. I wouldn't want my friends and family to be treated here." 3 consultants told the inquiry they no longer feel psychologically safe at work, and several have been on sick leave, one for more than a year, demonstrating the impact that the toxic power struggle has had on them. Female doctors said the department was sexist, and one had a miscarriage in 2023 during 12 hours of operations because she felt it's not the environment to take time off and have female issues. Nick Bunker, the divisional director of surgery, told the investigation the situation was absolutely affecting patients. He added that the surgeons genuinely feel that others in the team are trying to get them fired, paranoia, ruin their careers, paranoia, or are systematically undermining them, threat to control. In her 213-page report, Dobson concluded, there was significant evidence that service delivery and the performance of the team will continue to be impacted by this level of dysfunction. Of most concern was the view held by a number of consultants, junior staff and medical management that patient safety has been or potentially could be impacted by the deterioration in the working relationship between these 4 consultants. It's not clear when the problem started, but one consultant claims to have been bullied by a more senior consultant for 20 years, sustained period of activity. The situation appears to have got worse since 2017 and culminated in a doctor filing a dignity at work complaint in 2023, resulting in the investigation. Junior doctors, registrars, consultants and anaesthetists told the investigation of a nightmare and horrible work culture in the team, which leaves them constantly looking over your shoulder as to where the sniper is, the proverbial treading on eggshells, an environment which is invariably created by the narcissist's need for control and fuel. The report into 200 allegations and concerns upheld complaints of sexism and bullying, as well as highlighting incidents of homophobic and racist comments. Nazir Nasser, a senior consultant, allegedly made a string of offensive remarks, including that he wanted to stab any homosexual, dismissiveness, smearing, used the N-word to describe black colleagues, insult, and made an inappropriate joke about a patient who had just had jaw surgery performing oral sex, belittlement and dismissiveness. Nasser is 80 and still operating. The report did not find the majority of doctors guilty of racist and homophobic remarks, but it did refer Nasser to the Trust for potential investigation after numerous claims about his inappropriate behaviour. Nasser denied, first line of the twin lines of the narcissistic defence, all the allegations made about him in the report, but he was heard calling a woman that Indian bitch, racism, insult, belittlement during his telephone interview with the report's author after he believed the call was over. The investigation found the tense atmosphere was predominantly due to irreparable relationships between 4 consultants: Professor Simon Holmes, the trauma lead, who was appointed in 2003, Naeem Ali, a senior consultant, also appointed in 2003, Ashita Basu, the team's only female consultant, who was appointed in 2021, and James Simerman, who was appointed consultant in 2022. 2 more consultants, Nabil Bhatti and Nasser, already mentioned, are alleged to have behaved inappropriately. The doctors were divided into various camps. Bhatti, Nasser and Holmes appear to have built an alliance on one side, and Basu, Zimmerman and Ali on the other. The report details retaliatory allegations between all the doctors, the back and forth, the tennis match that I alluded to earlier on. Dobson heard accusations that Holmes bullied female colleagues, made homophobic comments, and put pressure on doctors to cover up poor surgery. Lack of accountability. After a woman went blind following surgery by Bhatti in January 2023, Holmes was accused of putting pressure on 3 junior doctors to write positive statements to cover up the problem. Lack of emotional empathy, manipulation. The report said that Holmes had asked junior doctors to write statements, but it could not conclude whether they had been put under any undue pressure because none agreed to be interviewed. Holmes was accused of bullying Basu for 20 years, including calling her Bubbles, pet name, and making offensive comments about her appearance and weight, insult. After Basu told a nurse during a trauma clinic that she was worried she could be developing an enlarged thyroid on her neck, Holmes interrupted and said, "I think that's just a fat neck, Bubbles, because you're fat." Insult, belittlement. This has had a devastating effect on my mental health and has resulted in my work being fraught with anxiety and self-doubt, Basu said. In another incident, Zimmerman was absolutely floored after Holmes allegedly told another doctor sitting at a gay colleague's desk, "You want to be careful sitting at that desk. If you sit there too long, you'll turn gay." Insult, smearing. Holmes denial, making the comment, telling Dobson, "It's not the kind of thing that I would say because I am very much in work. It's work and nothing sexual at work." He also denied making sexist comments towards Basu, saying, "Absolutely, 100% not. How ridiculous. No." Several staff made alarming claims about Nasser. He is alleged to have told one registrar that he did not want to be served by this dirty, fat black woman. Insult, smearing, working in the hospital canteen. Colleagues also told the investigation that Nasser said he hates gay people, openly spoke about using prostitutes, and described an oral surgeon as the black bitch. Insult. Objectification. Female doctors complained of being subjected to totally inappropriate advances from Nasser, lack of boundary recognition, sense of entitlement, who made lewd comments about a registrar's photo on her ID badge, told women they should wear more open clothing to get ahead in their careers, and made a sexualized joke when one complained of neck pain. Following the conclusion of our MS Teams interview, when I had left the meeting before Mr. Nasser ended the call, the recording of the meeting captured him saying, "Horrible woman, that Indian bitch. Horrible, horrible, horrible woman." Dobson wrote, "It's not clear who Nasser was referring to." The report also said that Nasser convinced one doctor to withdraw their evidence from the investigation, coercion and pressure, an intervention the author described as highly frustrating. In February 2022, after Basu became the unit's only female consultant, she alleges Bhatti turned to her in the consultant's room and said, "We're going to have to get a tampon machine in here now that you've started." Holmes is then claimed to have responded, "Sure, you're past all of that now, is she?" Basu also claimed when she tried to give Bhatti advice on how to mend a patient's jaw, he responded by saying that he doesn't take advice from women who bleed once a month. Sexism, dismissiveness, belittlement. Bhatti denied the allegations in the report, saying he had no recollection of such comments being made. The report said that Ali lost his temper, heated fury in a clinic, and got into such a heated conversation with the patient's father that someone had to walk out of the clinic before it got physical. Ali had such a poor working relationship with another consultant that the pair refused to work together, and 7 patients subsequently had their operations cancelled. Ali told the report he believed the patients were told the cancellation was because he had retired, which is untrue. The senior consultant was also accused of bullying various colleagues. In a statement, Ali rebutted the allegations as a gross misrepresentation of the facts or an attempt to deliberately discredit him with false claims, playing the victim. He did accept that patients had their operations cancelled, but claimed this was a decision taken unilaterally by managers without input from him, blame shifting. He added, "I have always taken pride in providing the highest standards of treatment and care to all my patients." Basu felt unable to approach Bharti after a very difficult operation to ask for help. As a result, the outcome for that patient had not been as good as they would have hoped. Accordingly, a genuine victim of the behaviour of one of the narcissists described is unable to seek help from this person, resulting in a detriment to a patient. She said she had tried to speak to Bharti about her plan for the patient before surgery, but he did not engage with her because of their feud, silent treatment, assertion of control. Later, she said she was threatened by Holmes, use of threat, who implied he would refer her to the General Medical Council over the case if she didn't support him in a separate bullying complaint made by Zimmerman. Basu declined to comment. Failure, of course, to respond to the allegations. Zimmerman said the unit was a dysfunctional and nightmare place to work. Colleagues accused him of bringing their cases to team meetings with the express intent to discredit their work. Bart's Health Trust said it was taking the findings extremely seriously, and a review of the allegations had started. At least 4 surgeons who've engaged in behaviours of bullying, dismissiveness, all in pursuit of the prime aims, that this has gone on repeatedly, and it has resulted in a dysfunctional unit in respect of the facial trauma unit at Bart's Health NHS Trust. A range of narcissistic manipulations and behaviours demonstrating the dynamic when several narcissists come together and repeatedly need to assert control over the other, resulting in racism, sexism, misogyny, homophobia. An excellent example of, first of all, why narcissists would be attracted to medicine in the first place, because of how it caters so much to the prime aims, and how, in this instance, their need for control over fellow narcissists threaten their need for control, resulting in the tit-for-tat and retaliatory behaviours, bullying, dismissiveness and insults that you've heard all about. I'm H.G. Tudor. Thank you for listening.